All right, fertility. We're chatting about it all today with Dr. Ross. We also had so many great questions about fertility, which, leads me to, of course, believe that we should be talking about fertility more. There were also so many questions on how to boost fertility, if there is such a thing as being able to boost fertility, what you can do to increase your chances to get pregnant. So Dr. Ross is a OBGYN. We're going to talk to her. She also does so many other things. She's written an incredible book called Sheology, and also just has a really great online presence with her practice, and also just with so many other things that she does that talk about women's health and vaginal health, fertility, and also vaginal pleasure. Her Instagram account is really fascinating, and I love following it, not only because she posts so many amazing videos and images of childbirth, which I think is so incredibly beautiful and fascinating to watch and to learn more about. But she also talks really openly and honestly just about pleasure and how we don't talk a lot about it, and women don't feel comfortable talking about it. So we'll talk about that as well. And if that's something you're interested in, definitely follow her account. Hi, Dr. Ross.
Good morning. Hi,
Good
Katherine.
morning. Thank you for joining me bright and early.
Of course, it's
I
always a good time to talk about the vagina.
I know. There's never not a good time to talk about the vagina. First of all, thank you so much for joining me. I'm really not surprised, but happily surprised to see how many people wrote questions about fertility. And I'm glad that we decided to talk about this. We were going back and forth with which topics to talk about. And I think given the time of year, people are, wanting to set their intentions for the new year. Fertility is on the mind of a lot of people, and family planning. If you're single, if you are not single, if you are wanting to start that, it's on the mind of a lot of people. So I'm glad that we decided to talk about planning for future fertility. This is a subject that you talk a lot about in general, but also in your practice. So let's just start with talking about when fertility should even be on people's radar, men and women, but obviously you deal primarily with women.
Yeah, I mean, you're absolutely right. There is a ton of fertility anxiety,
Yeah.
and I think it's gotten a lot worse. The good news is we're all starting to talk about it. And it used to be early 30s is the time the biological clock starts ticking. But now we're saying, hey, late 20s. And probably the truth is you're never too young to start thinking about your family planning.
Right. And when you say that it's either getting younger that you tell people to prioritize it, or that people are having more anxiety about it, why do you think that is?
Well, the truth is, women now, we're just getting into our stride. We're, sitting at the head of board tables. We're CEOs, we're wanting their promotions. And then we have to think about motherhood.
Hmm.
And motherhood is everywhere. I mean, everyone is talking about it. Everyone wants to know, when is the fertility cliff, and the biological clock. So there is more anxiety. There's a lot of pressure on women nowadays. I mean, have you heard about the motherhood, penalty? Where women who are, sort of like, there's a price to be paid if you're in the workforce,
Right.
and you're going to make, maybe not get that promotion, or you're not going to have the same, hourly wage.
Hmm.
So, we know women know more. The internet, social media is helpful,
Hmm.
and it can be scary, terrifying to many. So there is a timeline. I mean, we know age is the number one issue as it relates to your risk factor for infertility.
So if women are in their late 20s, if they're in a relationship, obviously that puts them in a different category. If they're, married, if they know who they want to start their family with. If you don't know who you want to start your family with, but you do know that one day you want to be having children, you want to enter motherhood, what do you tell someone who is in their late 20s, early 30s, who is doesn't know who they're going to be with to start their motherhood journey, but they want to also make sure that they're smart about that.
Yeah. And I mean, sadly, you can't wait for your doctor to bring it up in your, 10 to 15-minute well woman exam.
Right.
Um, so we don't, the medical system is so broken, and women, to really talk about fertility, they almost have to bring it up themselves. So,
Mhm.
To your question, I think it's important to bring it up to your doctor to say, hey, how does my medical history look? I have regular periods, which is good. I mean, certainly if you have irregular periods or pelvic pain, any sign of, PCOS or endometriosis or fibroids, that could delay the process.
Mhm.
So empowering yourself early. Be your best advocate, ask the doctor the questions, and start exploring what that looks like. When do you think I should start? If I don't have a partner, and it doesn't matter if you're single, straight, gay, it's always a good time to start talking about it, whether you do it yourself
Mhm.
or with somebody, because nowadays, families, there's just so many different ways to create
So
one.
true. Yeah. No, it's definitely true. I think that, you know, I hear so many of my friends, I'm 33, I'm going to be 34 next week. And I hear so many of my friends talk about, do you freeze your eggs? Do you not freeze your eggs? And I also have, I have a lot of younger girl cousins who are in their 20s or their late 20s. And they also are thinking like, do you freeze your eggs? Are there tests that you can run? And we've talked about fertility on BDA Baby before. And there are things that you can get tested as far as, getting your blood tested or getting different parts of your fertility map tested before jumping into the egg freezing process. Can you talk a little bit about what that's like?
Yeah. Yeah, I mean, egg freezing, like that is the perfect birth control is family in your family planning
Hmm.
roadmap is egg freezing. The biggest problem is it's very expensive,
Yeah.
which it shouldn't be. I mean, companies like Facebook, or Google, some of them do pay for it, which, I would love to see more of us standing arm in arm and demanding that our workplace can help that payment of somewhere between 12 and $15,000 per cycle. Not to mention the $800 to store your egg.
Yeah.
But it is a great, great option. Now the flash freeze process, makes it a very viable option. And when a lot of my patients do this, and maybe it's a grandparent, a future grandparent
Mhm.
that gifts it to their kids, or to their daughter, it just, the sort of that calmness of, and the release of pressure of getting pregnant and finding a partner, even do I want a partner?
Right.
um, you know, all those questions you don't necessarily have to have answers to. So it's, understanding, does your insurance cover it? Because also we're seeing more insurance plans covering fertility process like egg freezing.
Hmm.
Um, so it is a wonderful option, and I highly encourage it. To your first question, what about blood tests?
Hmm.
What kind of, strength do my ovaries have, and my follicles? How are they looking?
Right.
So the main test we do is called an AMH, anti-Müllerian hormone. You do it anytime during the cycle, and it tells you what we call your ovarian reserve. And that just means, the quality, your genetic quality potential. I mean, the one question we don't know is, well, how long is that AMH good for?
Right.
Is it a year? Is it 2 years? So these are the kind of questions that you need to bring up with your doctor, because you can't wait. If you wait, you might miss your sort of fertility window.
So, kind of the first step for people that's kind of the easiest and simplest step is a simple blood test that will tell you your AMH levels. And
Yes.
from there, and I recently had a friend who did their AMH levels in their early 30s and had, a doctor say to them, like, listen, based on your AMH levels, you're probably not going to get pregnant. You have a very low chance of getting pregnant. And obviously, fertility is a very sensitive subject. It's also a very weighty and heavy emotional subject of how you communicate that with somebody or how you discuss that conversation. Obviously, you are, so caring and nurturing. Your mother yourself. You also take care of your patients in a very unique and gifted way. Also, so many women do not have that experience with their OBs. So when they go and have that, they, feel like, oh my God, I'm never going to have kids. They're lost. They don't know what to do. Do you have any kind of words of wisdom for people to feel like they can take charge of their fertility journey, or kind of what to do after having somebody tell them, like, listen, you're probably not going to have kids, and feel discouraged?
Yeah. Well, and it's so sad, Catherine, as you know. Here's the thing. You always want to get second opinions.
Mm-hmm.
You never base your fertility on just one blood test, because that AMH, for whatever reasons, it can change. And I've seen this too, where, patients have come to me as on a second or third opinion, and, feeling doomed that they can't have babies of their own genetics. And then we repeat the blood test and it's normal. So I think, it's so important, while you're doing the journey of fertility, is you have to educate yourself, use reliable websites on, Dr. Google, try to use reliable medical websites,
Mm-hmm.
and always find a doctor. Always, always find one that you feel comfortable with. They exist. Go online. I mean, Yelp reviews, for better or for worse, they can be so helpful.
Yeah.
Talk to your friends, women, your BFFs, your cousins, as you do. I mean, there's a lot of options out there, and there's a lot of good doctors who will take the time with you to help create what I like to call a short-term plan and a long-term plan.
Mm-hmm.
The short-term plan is information gathering, knowing your fertility options, knowing your own gynecologic and sort of ovulation history as it relates to regular periods, because your period is truly your barometer of health.
Mm-hmm.
In a lot of ways. We don't think about it. When you come in with a regular period, I feel good about your ovulation.
Yeah.
Right? When you sort of look at the causes of infertility, it's not just women, as we know, male factor is up to 40% of the cause.
Right.
Fine, something we can not take all the blame for. So, right.
True.
So it's right. So there's a lot of information gathering, finding your healthcare, person that you're going to go through the journey with. It's a long journey, right?
Mm-hmm.
And you want the comfort and the sort of environment where you can ask the hard questions.
Yeah. When it comes to, boosting fertility, that was a really popular question that we got, since yesterday. And also just a question that I feel like all of my friends who want to have kids or are trying to have kids, people talk about, can you boost your fertility? Is there such a thing as, supplements that boost your fertility, or changes in your lifestyle that make you a more fertile person? What are your thoughts on that?
Yeah.
Is that something that you can actually do?
Well, yeah, the answer is yes. Basic lifestyle changes that we don't think about. And probably the number one thing is managing your weight. We know that if your BMI is under 19, or if it's over 30, these are sort of the underweight and overweight with less fat,
Mm-hmm.
affects ovulation, right? And if you're not ovulating, that can, decrease your chance of fertility and getting pregnant. Things like exercise and keeping your body in a less stressed state is also really important. Stress is found also to affect ovulation and successive fertility. Your diet is important. Looking at your caffeine intake and making sure, you're drinking, 200 milligrams, or basically it's one, cup of coffee, one latte a day,
Mm-hmm.
or iced tea. Supplement wise, we look at just a good prenatal vitamin that has folic acid, of course.
Mm-hmm.
That's still sort of the superpower vitamin that we like to decrease neural tube defects, spinal defects like spina bifida. So those are some basic things. I mean, we look at acupuncture. Why not? Right? Mindfulness, yoga,
Yeah.
things that just make sense
Mm-hmm.
to keeping your body in a good, healthy state, and even getting good night's sleep. I mean, those are just lifestyle, sort of standards that we'd like people to follow at least, 6 months ahead of time before they even want to get pregnant.
And what about supplements? I feel like the supplement space is such a big one. People want to be able to take something and say, oh, this is going to make me more fertile. This is going to make me sleep better. It's going to make me look younger. It's going to, people want to be able to take something. You look at the market and people always say, take this to be more fertile, take this to boost your fertility, or eat this, integrate this into your diet. Is that real? Is that something that, you would tell people who are looking to boost their fertility to buy into?
Well, listen, creative marketing, we're all a victim of that. Um, but the short answer is probably not, but we know certain supplements like CoQ10, that's always sort of on the radar for infertility that might help give you a slight boost. But there's nothing really in the supplement space that's going to help that sperm, hit that egg at that right time during your, the high fertility part of the cycle. But it's sort of this collective of being your healthiest self, I do think is important. And, weight is a huge one that we don't really think about. And as you roll into your early 30s, this is the time when you have to start thinking of long term about, what's happening in your body and how weight is really important, and stress.
Yeah. I think that the overall theme of a healthy lifestyle and a good sense of calm when it comes to your fertility journey. Of course, the idea of that is, it's more achievable to so many people. If they don't have to go buy a supplement, they can really integrate, if it's yoga, if it's walks, if it's, some sort of practice every day that keeps them in a more calm space to be able to actually get pregnant. Because I remember a long time ago someone telling me that your body is actually smarter than you think it is, because it will prevent you from ovulating or not even allow you to get pregnant if you are incredibly stressed out. It doesn't view your body knows, like, this is not a good time to get pregnant. So it also, people don't necessarily always think that your body is aware of your stress levels and also aware of, this is a good time to get pregnant, or this is not a great time to get pregnant. So the importance of keeping calm and not having high stress levels really does, impact your ability to get pregnant, as you're saying.
It's so true.
When it comes to male fertility, I feel like that's something that we're kind of creeping into talking about, but also so many people ask just about how to even tackle that subject, because it is, historically fertility is so focused on women. It's all about, women, you're the one with the problem, you have the issues, there's something off with you, you should go get tested. And the reality is, for a lot of men, it can be taken as too personal. They get very defensive historically. And when in reality, it's actually a pretty easy thing to test men's fertility, right?
Super easy and super fun for them. I mean, if they have to go to what's called a masturbatorium at the infertility doctor, who wouldn't want to go to a masturbatorium, right? I mean,
That's
right?
hilarious.
So, the other thing, I mean, we talked about some stress and obesity and so on, but, we look at medical history and certainly we want that in check, and other, for men, let's just focus on men, and the 40% of infertility is male factor. Well, what causes it? Things like minoxidil for hair loss, and some women don't even know their partner's using it. They're closeted because they don't want to, hair loss. It's another taboo topic to think that they might be losing their hair,
Right.
but it can affect sperm. We look at sperm, I mean, we look at how they're swimming, we look at their anatomy, and, just their ability and their volume to be able to get to that egg. So to your point, I mean, if you have a partner, if it's a male partner, yes, you should go in with your person and go in 6 months ahead of time, meet with your doctor and talk about all these issues. And hopefully you will be asked, or your male partner will be asked, about what medications. And, weed is another one. Now you're vaping and you're doing all this with weed. And that can affect sperm too, depending on how much you're using.
Mm-hmm.
So it's an education for the couple. This is not, if you have someone, it's not a one-person show, unless you intend to do it, by yourself. But because male factor is 40%, they just have to go get their sperm checked, and we see it so often. And it's also can be an
I
easy
heard sperm
fix.
check. I love it,
Oh,
honey. Mm.
speaking of sperm,
I
Yeah,
know.
speaking of
we know
sperm,
He
we
heard me
know
saying
we
sperm
know
check
your sperm
outside
is
the
good.
window.
what are you doing in there? Hi there. Hey, Doc. How you doing?
We know your sperm is good, Chris. So.
I love you, honey. Bye.
Bye.
Have a good day.
Okay, so thank you for hearing the sperm word and needing to come in.
That was a good cue. That was
I
a good
know.
time.
Great cue. Did it right on time. I mean, I think that the idea of women being able to also factor that part in and not taking on like that being a full responsibility for them. I hear so many of my friends who are on their fertility journeys taking their, significant others, making them a really big part of it, and not as the woman making this something that's completely on you, which I think it seems like it's a fairly new part of just the subject of fertility, which is really interesting to me, but of course makes total sense.
Yes.
Yeah.
Yeah, and it's true. It's true. I mean, it's really nice at any hormonal stage, pregnancy, postpartum, menopause, perimenopause, as we talked about. I mean, it's nice to feel that the people around you are supporting you, especially the person that you're, sharing your life with.
Yeah. So when it comes to secondary infertility, that was something that, people also talked about. I'm sure, you deliver and have delivered so many babies, and people who are wanting to family plan, have another baby either right away or plan it out in a different way, and then struggle with secondary infertility. Is that something that you're seeing a lot of, or is that something that as an OB that you would handle or refer to a specialist to tackle for someone who experiences that?
And it's a good question. It sort of depends on the cause. Secondary infertility can be because you're older. What is the fertility cliff? What is, the older patient, we used to think over 35. But really, it's sort of over 40 in a lot of ways. That's, there's no such thing as a geriatric pregnancy. I think people get really offended by that word, and I don't blame them.
Yeah.
I mean, the ideal time to get pregnant is in your 20s, but, secondary infertility that could cause recurrent losses is if you're over 40, and we know your fertility rate really goes down drastically at over 40. So recurrent losses can sort of be one of the things that we do see. If you have more than, 2 miscarriages, we will refer you to a specialist. Like, I'm just an OBGYN, so I do routine things. But if it's beyond that, and certainly over 40, if you've had 1 miscarriage, we may send you early.
Right.
In fact, infertility used to be 1 year. You wait 1 year of trying, and then the 11% of infertility, infertile couples will go to the, infertility specialist. But over 40, over 35 now, if you, can't get pregnant within 6 months, then we refer you. So that's changed.
Yeah.
If you have a big growing fibroid or polyp, that can cause infertility, and because you've waited, and that can affect implantation of the embryo, that might be something that we also can take care of. Your gynecologist can. So it sort of depends on the age and the circumstances.
Yeah. And when it comes to we talked about, the kind of your 20s being an ideal way of being able to start getting pregnant at that time. For a lot of people now, that's delayed for, most people. As you said, women are working, women prioritizing their careers, which is great. And also that comes with women deciding to have babies often later than, in your 20s, because that's just the world that we live in now. And for people who are looking at, let's say, in their 30s as being a time that they want to have kids, someone had told me a long time ago some crazy numbers as far as when your fertility starts kind of tapering off as being not a great time to get pregnant. You mentioned geriatric pregnancies, which I was told is after 35, you're considered to be a geriatric pregnancy, which is so
Right.
crazy.
That's right.
If you look at your 30s as being kind of the time where most people are having babies now, what phases of in your 30s does your fertility start really being impacted?
It's really sort of closer to 40, over, I would say 38.
Mm-hmm.
And remember, if you're 37 in 4 months, you're really 38
Yeah.
because you add 9 months. That's sort of your ovarian age as it relates to, genetic abnormalities. But it's sort of closer to 40, closer to 38. And that's usually the time that I would, highly recommend women if they're doing it by themselves, doing it with a partner, wanting to freeze eggs. You really want to do it because over 40 is when it changes. And I think you cannot wait until that age because, your miscarriage rate, I mean, for everyone, it's about 20%. Over 35, it's going to be closer to, 25 to 30%. And certainly over 40, it's going to be closer to 40%.
Right.
So, you have to think about this and because it does take time
Right.
to get pregnant, you have to factor that into it. So over 37, 38 is really the time that I think it really changes.
Yeah. So I think overall, when we talk about the subject of fertility, I think number one would be to get your AMH levels tested, which is done through a blood test, and you can do at any point in your cycle, right?
Yes.
Yeah. And, if you're told your AMH levels are too low or not good enough, being able to get a second or third opinion is always super helpful. The importance of having calm in your life when you're trying to conceive or thinking about fertility, and then being able to, as you were saying, start the conversation about family planning, fertility, and egg freezing with your healthcare provider, to kind of give yourself the sense of empowerment and sitting in like the front seat, the driver's seat of your fertility journey, because it might not always come up with your OB naturally, right?
Exactly. I mean, I think that that's all great information. And you have to be your best advocate.
Yeah.
You really do. You have to not wait. Get reliable information, find the right doctor. Some doctors do like to check the AMH on day 3 or 4. It's not always a have to, just as sort of an additive to what you're saying. But be your best advocate, and take control of your fertility because it's really your best birth control is planning your fertility.
Yeah. Well, I guess we're out of time. I think we need to do a whole other thing about the vagina and pleasure because it's such an important subject that I was saying when we came on that you talk so much about on your account, and I encourage everybody
Yes.
to follow your account.
I brought my vagina with me.
I love this.
I wore my shirt, Vagina Revolution. I got you one too, Katherine.
Oh my gosh, thank goodness. I cannot wait. I mean, we can just do like one little part of this, which is, just the vagina revolution, as you were saying. Pleasure is not something that women necessarily and historically have talked about when it comes to vaginal health, vaginal well-being, all of that, and just feeling comfortable talking about it. I remember an OB that I met a couple months ago said their number one question that they get from patients is about sex drive and pleasure. And I thought that was really interesting because I would have assumed that it would be about fertility or period or, whatever it is, but it's about sex and pleasure. Can you talk from your own perspective of, being in this practice and in this field for a very long time? What is all of that about, and why are we so not comfortable talking about it from a women's perspective, but when it comes to a male perspective, it's very comfortable?
Right. Well, again, this is sort of another cultural, religious, educational, fault that women, it hasn't been equalized, right? Women just have babies, and I think now in this day and age, women are demanding equality under the sheets in every aspect. I mean, we're marginalized in so many ways, but we have to talk about it. We have to acknowledge our desire I mean, desire, it's like eating and drinking. It's part of what makes us a person is our sexual desire. Women have it too. We don't speak about it as much because then it becomes negative. Then we become, what's our problems, or, we're watching porn and how that has kind of created a negative impact on women. But first and foremost, I always tell women is to know your anatomy, know your vulva. Know where your clitoris is, know what it's about. Know that the clitoris, with its 10,000 nerve fibers, more than the penis, its sole purpose is to give you pleasure. And we're not talking about masturbating. I mean, that also feels like a taboo, but you have to know your roadmap. So I encourage women, and I see a lot of young, gals in their teens and adolescents, and I pull out the mirror and we go through it because not everybody knows where their parts are.
Yeah.
It used to be that this was the vagina, right? It was all encompassing. And now, I mean, I think we've come a long way at identifying the parts. That is first and foremost. You have to know what it is. You have to know your clitoris is there for a reason. Don't be afraid of it. Learn about it and masturbate when you're younger so you can then share that with someone else. I mean, to expect your partner to please you, and if you don't even know what makes you have an orgasm is really step number one. I mean, you have to not be embarrassed about it. You have to learn about it, love about it. We all have to talk about it and give each other approval.
Yeah. I mean,
And,
I remember talking to somebody about fertility and also hearing them say that when it comes to orgasm, people think, oh, it's not something that we should be talking about, especially if your goal is to get pregnant, and that orgasm actually helps you get pregnant because it helps your the sperm swim, right?
Right. Yes. So when you have an orgasm, there's contractions, and there's within the uterus, and it sort of sucks up the sperm into the vagina, into the uterus, and fertilization happens in the tube. So, usually after I do an IUI, an intrauterine insemination in my office, I close the door, I, make the lights low, and I say, just go ahead and have an orgasm. Just go ahead and do it. I don't care if you do it yourself or with your partner, but it's going to help.
Yeah.
So yes, to your point.
Yeah, it's so interesting. I mean, people, when it comes to fertility or just pleasure in general, it's as you were saying, it's so important for you to be able to have knowledge of your own body and also what feels good for you, what makes you happy, what makes you feel pleasure, because, the reality of just assuming that someone else is going to figure it out for you is probably not ideal.
It's absolutely not. And I think, the reality is up to 20% of women have never had an orgasm, Katherine. It's pretty startling. And I always ask my patients, how are you doing sexually? Are you able to orgasm? Have you ever had an orgasm? Especially those under 25. And half of them say no. It is
Wow.
really not that surprising. So it's allowing people to talk about it. It's going over it. It's talking about the clitoris. It's talking about, the importance of, getting there and giving them strategies, because for women, the average orgasm, it takes 14 to 20 minutes. For the male, 3 to 5.
Wow.
So so that is what we call the orgasm gap.
Yeah.
And men should know about that, because, it's just not going to happen for women. If it's, foreplay doesn't last very long. I think the average foreplay is like 10 minutes. So the numbers don't add up. So again, it's more of a reason for women to talk to their partner about what makes them feel good. This is what makes me feel good, to really talk about it. And it's not always with anything inside the vagina. Most women, only 25% will have an orgasm during penetration sex without touching the clitoris, right? Unless there's some positional change where the clitoris can rub up against the penis or on some, bony area that can help, or bring in a vibrator. I mean, everyone should have a vibrator, and not just one.
It's the holiday season. Get your friends a vibrator.
100%. I mean, you have to. It is the best. And it shouldn't make your partner feel less than, but even for masturbating, it's just go to magic wand is like, the best. I mean, it's one of the better ones.
Yeah, you post a lot about, about vibrators and just about pleasure when it comes to women exploring that and also feeling comfortable with it. Maybe we can include that in a sort of gift guide. You should do a vibrator gift guide for people over the
Yeah.
holidays and really
Yeah.
just get people
I'm all
set for the
for
new
it.
year.
100%.
Yeah,
Everyone better get a vibrator or get a better vibrator.
exactly.
It's just so important.
Yeah.
I mean, there's so many medical benefits too to having an orgasm. I mean, just from a doctor standpoint, I prescribe orgasms often for people, who have a lot of stress or depression or loneliness because it's such a feel good endorphin lift. It's good for the heart. It's good for sleeping. I mean, it's a great sleeping pill. It's just, there's so many benefits that, are good for the body and blood flow and even for the vagina for moisture. And um, it's a long list of benefits.
Doctor's orders, have an orgasm.
Exactly.
Love
I've
it.
written it.
Exactly.
I've written it on a prescription pad. I have, Katherine.
I know, I'm sure you have. Thank you so much, Dr. Ross. This was so fun
Always.
and amazing. And I think that this also gave such great tips for people who are experiencing fertility challenges. And also as we end the new year and people think about their years next year, so many people think about family planning around the holidays and as we lead into the kickoff of a new year, what that will look like for them next year. So these are such great tips. And we're going to do a whole other one just about the vagina specifically because
Oh my God.
we
There's
could
a
just keep
lot
going.
to talk about.
I know.
Our girl, a lot to talk
Girl,
about.
so much to talk about.
Right. I guess you have to wear your shirt.
I
too.
know. When we do this
I'm
next time, I'll wear my shirt, so we'll be matching.
I got one for Christina too.
Oh, thank God. I love it. We'll all do it together. Thank you so
All
much,
right.
Dr. Ross.
Of course.